may be seated. Good morning. I'm pleased to welcome you to the Tennessee College of Applied Technology's Dental Assisting, Surgical Technology, and Practical Nursing Pinning Ceremony. Thank you, family and friends, for joining us for this special occasion. I'm honored to extend a heartfelt congratulations to our students. We're so proud of you and your accomplishments. This ceremony is about you. It's about your hard work and determination. It's about your perseverance and commitment. You are the future of the healthcare, and we are excited to share in this moment with you and your loved ones. Your pin is a symbol of your achievement and a reminder of the trust and responsibility of being a healthcare provider. You are embarking on a fulfilling career where you will make a difference in the lives of countless others. We are immensely proud of you and do not doubt you will excel professionally. Congratulations once again on this well-deserved honor. May your future be filled with success, fulfillment, and opportunity to impact the lives of others positively. I would also like to take this opportunity to thank the instructors. Thank you for investing your expertise and talents in training the next generation of healthcare professionals. With that, let me introduce Instructor Marcy Owen.
All right, good morning. Thank you for joining us. I have a history of running long. I'm going to be efficient. I'm going to be succinct. I'm going to stay on script, and I'm going to try not to cry. But I do want to recognize just how proud we are of these dental assisting instructors and students. See, I can't even think because I'm trying not to cry. Many of these students, I hope that you realize how hard that they worked. It wasn't just the hours of study that they put in. It wasn't just the dedication to skills training. It was overcoming a lot of challenges that they had even in their personal lives. Many of these students completed this program while raising children, maintaining a job outside of classes, even during clinicals, medical or financial hardships, personal adversity, or family emergencies. Some of these students commuted over an hour away, one way, every day to attend classes. That's dedication. And they have all persevered to complete their educational and training goals in their chosen career path. These students are quite frankly, amazing. These students have shared many wonderful, challenging experiences together, and they strove to meet every one of them with good humor, determination, and professionalism. They showed their support and enthusiasm for the growth of our college at the Covenant campus ribbon cutting. They helped us pack up and move an entire department across Knoxville. They have taken certification courses together and, of course, commiserated on clinical externship experiences together. Some of our students represented TCAT in our program at the TBR quarterly meeting and the Tennessee Legislative Luncheon hosted at the Covenant campus, like Shelby and Griffin. There were those students that came in with a smile every day, like Chloe and Iris. Those that asked probing questions, like Kiana and Marley. Those who always wanted to get their skills just right, like Seth and Caitlin. Those who kept us laughing, like Sarah and Shelby and Destiny. This class is just remarkable. They have put up with all of my last-minute changes to the lesson plan. They collaborated with one another, encouraged one another, and generally we were laughing most days. We've had difficult days too, days where there were tears in the hallways about skills, or classmates that separated from us sooner than we would have liked. And somehow these students still push through to attend classes despite stresses in their personal lives. You guys are made of very impressive stuff. And I know that Miss DeSilva's banana bread always helped to lift our spirits too. We have National Technical Honor Society. You have to have an A or a B overall average. You have to have missed fewer than 24 hours in a term in order to be nominated. Every student that is here in dental assisting has at least an A or a B average, and nearly all of them were nominated to National Technical Honor Society. Congratulations. Additionally, we elect a class valedictorian and salutatorian. The race for this honor was so tight. I literally had to break the grade averages down to the second decimal place to make any distinction. With that being said, I would like to recognize Miss Alyssa Davis and Miss River Knott as our co-salutatorians. And Griffin Beeler as our valedictorian. Congratulations on all of your hard work. The dental assisting program requires a total of 864 hours of enrollment, and these students felt every minute of it, including finishing sealant certification yesterday afternoon. 150 of these hours, they have to actually be working chairside in a real working practice. This is a 7 to 8 hour day. This year, we've had several students who have missed 5 or fewer hours for the entire 8 months that they were with us. Students like River, Briseida, Maddie, Sarah, and Seth. However, we have one student with perfect attendance, Miss Alyssa Davis. We commend you on your impressive dedication. So our dental assisting program has provided education and training to students while adhering to those standards that are set forth by the Tennessee Board of Dentistry as well as the Council on Occupational Education. The objective is to provide the student with all of the knowledge and skills that are needed not only to become an experienced dental professional, but also quality employees. To date, most of these students have already accepted an offer of employment with a dental practice. Congratulations to each of you. Today, you are going to hear from Ms. Griffin Beeler, who will speak on her experience with the program over the last 8 months as a representative of the class. And following this will be the presentation of candidates with their ceremonial pins and their wisdom teeth. Why wisdom teeth? We recognize that many healthcare programs do something to symbolize the knowledge that is passed from instructor to graduate. And the definition of wisdom refers to the quality of having experience and good judgment in addition to knowledge. Wisdom was also defined as the soundness of action or decision with regard to the application of these qualities, experience, good judgment, and knowledge. Over the past 8 months, these candidates have gained valuable experience, learned to practice good judgment, and demonstrate knowledge and understanding of their principles, techniques, and ethics of the dental assisting profession, all of which they will use to guide their actions and decisions within the field of dentistry and scope of practice. We selected the wisdom tooth as a symbol of these definitions and qualities as they apply to these new dental assisting professionals. Before the presentation, I would also like to recognize any family member or friend who encouraged and supported these students in meeting their academic and career goals and superlative accomplishments. These students could not have succeeded without you, and their success is your success. And I would also like to thank TCAT Knoxville's faculty, staff, and administration for your encouragement, involved support, and provision of resources, always with the success of our students foremost in your decisions. Thank you. I would now like to present our class valedictorian, Ms. Griffin Beeler.
Good morning, everyone, and thank you for showing up and showing out for us today. We are extremely thankful. If I'm being honest, standing here today feels surreal. There was a time not long ago when this felt so far away, when the finish line seemed distant and some days almost impossible. To be named valedictorian is an incredible honor, but this moment isn't mine alone. It belongs to every single one of us, because we all know this wasn't easy at all. When we first walked into this program, we didn't just carry backpacks, we carried doubt. We carried fear of failing. We carried the quiet question in the back of our minds, am I really cut out for this? We were strangers then, sitting in the same room, but living in our own nervous thoughts. We didn't know how much we were about to need each other. There were mornings we showed up exhausted, days our hands shook during practicals, times we smiled on the outside but felt overwhelmed on the inside. Some of us cried in our cars, some of us went home and studied until we couldn't keep our eyes open, and more than once, I'm sure we all wondered if we were the only ones struggling. But we weren't. Because slowly, without even realizing it, we became each other's strength. We shared notes, we stayed after class, we whispered, "You've got this," before exams, even when we weren't sure about ourselves. We celebrated the smallest wins like they were milestones, and in between the stress and the tears, there was so much laughter, the kind of laughter that made the days lighter. Somewhere along the way, classmates became friends, and friends became family. This program didn't just teach us how to succeed in our field, it taught us resilience. It taught us humility. It taught us how to keep showing up, especially on the days we felt like we couldn't. And none of that would have been possible without Mrs. Owen and Mrs. De Silva. Thank you for your patience, for your steady encouragement, for seeing potential in us that we couldn't always see in ourselves. You didn't just teach us skills, you shaped our confidence, you pushed us when we needed it, supported us when we were overwhelmed, and reminded us that growth often comes from the uncomfortable moments. Your impact will stay with us long after today. As we sit here now, about to step into the next chapter, I hope we remember this feeling, not just the pride, but the perseverance, the late nights, the encouragement, and the way we carried each other through. Because the certificate represents more than completion. It represents courage, it represents growth, and it represents every single time we chose not to give up. I'm so proud of this class, proud of your heart, proud of your strength, and proud of who you've become. We didn't just make it through this program, we transformed in it. And the best part is, we did it together. Congratulations, class of 2026, we did it, yay!
Good morning. Thank you, Griffin, for those very kind words to all of the students of the dental assisting program. So, without further ado, will the candidates for dental assisting penning please rise? Iris Barahona. Griffin Beeler. Chloe Chandler. Alyssa Davis. Marley J. Kind. River Knott. Briseida Levere Garcia. Madeline Main. Sarah McInnes. Kiana Morgan Black. Destiny Sanders. Caitlin Slagle. Eva Shelby Tilley. Seth Wilson.
Now I'm going to present Miss Madeline Main. She is going to come up and she is going to lead the dental assisting class in the recitation of the Dental Assistants Pledge. Miss Madeline Main.
My fellow dental assistants, when embarking on a new profession, many people take oaths or make pledges as a declaration of their commitment to common professional goals and actions. Today, we will recite the Dental Assistants Pledge. Before these witnesses, we will promise to be loyal to professional team members and to safeguard the health and well-being of our patients, so that we might hold ourselves to a higher standard and not be tempted to waver in our ethical duties, professional responsibilities, legal obligations, or codes of conduct. Dental assistants, please stand and join me in reciting the Dental Assistants Pledge. I solemnly pledge that, in the practice of my profession, I will always be loyal to the welfare of the patients who come under my care and to the interests of the practitioner whom I serve. I will be just and generous to the members of my profession, aiding them and lending them encouragement to be loyal, to be just, and to be studious. I hereby pledge to devote my best energies to the service of humanity in that relationship of life to which I consecrated myself when I elected to become a dental assistant.
All right, congratulations, dental assisting students. So now we are going to move into our surgical technologist pinning ceremony, and it's my pleasure to introduce Ms. Abby Jedlicka.
Today is not just a ceremony, it is a milestone. It marks the transformation from student to professional, from learner to vital member of the surgical team. Whenever you first entered this program, you learned about sterile technique, instrumentation, anatomy, and procedures. You memorized trays, practiced your hand ties until your fingers ached, and learned that precision is not optional. It is essential. But beyond the textbooks, the skills labs, you also learned something even more important. You learned responsibility. Surgical technologists stand at the heart of the sterile field, protecting the patients who may never know your name, but whose outcomes depend on your vigilance. You have learned to think critically under pressure, to communicate clearly, and to function as part of a highly skilled team. Whether in general surgery, orthopedics, cardiovascular, neurosurgery, or obstetrics, your role will always carry one common purpose, and that is patient safety. There will be long days, there will be challenging cases, there will be moments that test your endurance and your confidence. But remember, you have earned your place in that operating room. You have trained for this, and all of you are ready. Graduates, as you receive your pins today, understand what the pins actually represent. It's not just a symbol of the completion of this program. It represents discipline, it represents competence, and it represents trust. When you wear your pins, you carry forward the standards of this profession, which is integrity, accountability, and excellence. Congratulations on your hard work. Congratulations, surgical technologist. I will now present Miss Emily Fletcher for the recitation of the Code of Ethics. Oh, I skipped the pins. Just kidding. Psych. You get your pins first. Candidates for the Surgical Technology Program, class of 2026, please stand. Mercedes Behanen. Shelby Clark. Michaela Franklin. Catherine Hayden. We love her too. Braden McCroskey. Belize Kurunziza. Belize, I think your family's here. Good job, honey. Good job. Carly Orison. Congratulations. Laura Rafferty. Olivia Seals. Jared Taylor. Autumn Tompkins. Deja Whitmore. Olivia Williams Zerby. Now I will officially introduce Miss Emily Fletcher for the recitation of the Code of Ethics.
Okay. The Code of Ethics of the Association of Surgical Technologists serves as a guiding framework for professional conduct, accountability, integrity, and patient advocacy. It defines who we are as professionals and the standards to which we hold ourselves. Graduates, please stand. As I read each principle from the AST Code of Ethics, please repeat after me. To maintain the highest standards of professional conduct and patient care. To hold in confidence with respect to the patient's beliefs all personal matters. To respect and protect the patient's legal and moral rights to quality patient care. To not knowingly cause injury or any injustice to those entrusted to our care. To work with fellow technologists and other professional health groups. To promote harmony and unity for better patient care. To always follow the principles of asepsis. To maintain a high degree of efficiency through continuing educations. To maintain and practice surgical technology willingly with pride and dignity. To report any unethical conduct or practice to the proper authority. And adhere to this code of ethics at all times in relationship to all members of the healthcare team. Congratulations to the Surgical Technology Class of 2026. You may now be seated.
Congratulations, surgical technologists. So now we will move into our practical nursing ceremonial pinning. It's my pleasure to introduce our Director of Allied Health and Nursing, Dr. Jake Terry.
Good morning, everybody. Before I like to get started, I wanted to congratulate you all on what you've done and your accomplishments, but I'd also like to recognize your instructor, who has been pivotal in helping you all to reach this goal. So if everybody would like to give Miss Michelle Anderson a hand, if you could stand up. Yeah. Thank you. Thank you. So today, as Director of Nursing, I have the extraordinary privilege of standing before you at one of the most meaningful milestones in your professional journey, your pinning ceremony. This moment is not just a celebration of completion of a program, it is a rite of passage. It marks your transition from student to nurse. The pinning tradition dates back to the time of Florence Nightingale, who was awarded the Red Cross of St. George for her service during the Crimean War. Later, she presented medals of excellence to her nursing students. Since then, the nursing pin has become a powerful symbol of knowledge earned, skills mastered, and calling embraced. Each of you arrived here with a spark, as a desire to care, to serve, and to make the difference. Over the past 12 months, that spark has been tested. You have endured early clinical mornings, long lectures, difficult exams, and moments of self-doubt. You have cared for patients on their best days and on their worst days. You have held hands of joy and grief. You have learned that nursing is not just about taking checklists or marking off checklists, but about presence, avocation, and compassion. You have also learned that nursing is both an art and a science. You can interpret lab values, calculate medication dosages, and recognize subtle changes in patients' conditions. But just most importantly, you can listen without interrupting, speak when something isn't right, and sit still in silence when words are not enough. When you wear this pin, you carry more than just a title. You carry trust. Nurses are consistently ranked among the most trusted professions in the world, not because of what we know, but because of how we show up. Your patients will invite you into the most vulnerable times in their lives. You must never forget that is a privilege. The healthcare landscape is ever-changing and it's complex. Technology will advance, policies will shift, challenges will arise, but the heart of nursing remains constant. We care for the whole person, body, mind, and soul. Let your practice be guided not only by evidence, but by empathy. Be a lifelong learner, ask questions, seek mentors, and in one day be a mentor to others. There will be days when you are tired, days when you question yourself. On those days, remember why you started, okay? Remember the patient who thanked you and called you an angel. The family who trusted you, the moment you realized I was meant to do this. Today you join a profession that is more than just a career, In its calling, you join generations of nurses who have stepped forward in a time of crisis, who have advocated for the voicelessness, and who have brought light to dark places. Graduates, I am incredibly proud of you. You have earned this pen, and you are ready. As you are penned today, know that you do not walk alone. You carry the support of your families, your friends, and the guidance of your faculty, and the strength of nurses who came before you. Welcome to the profession, and welcome, colleagues. Thank you. Now it is my honor to represent our keynote speaker, who is the Chief Nursing Officer of Prisma Healthcare, Mr. Joe Newsom.
Well, good morning. Graduates, families, faculty, friends, what a great crowd today. What a beautiful sight. To the Tennessee College of Applied Technology class of 2026, congratulations. You all did it. Today we celebrate not just the finish line, but the beginning of a lifetime of service. To our graduates, the hundreds of hours in the classroom, the hundreds of hours more in clinicals, and the countless hours studying every quiz, every skill checkoff, every early morning and late night paid off. You made it. And to the TCAT faculty and staff, thank you also. Your commitment to our students and to our healthcare profession is evident in every late night you spent prepping labs, every clinical rotation you coordinated, and every encouraging word you offered along the way. Thank you. Folks, let's name today's truth very plainly. Healthcare is hard. It's demanding in ways that touch your mind, your heart, and our backs. It's particularly difficult to be a nurse at the bedside, present in someone's most vulnerable moments, to be the operating room technologist who helps prepare the sterile field for a life-saving procedure, or the dental assistant working hard to calm anxiety and pain from an infection. But here's the paradox. We already know deep in our bones, the very work that's hardest can also be the most rewarding. That's why you're here. That's why we're here. That's why you all chose the hardest path. Every single one of you could have taken an easier road. You could have opened a business. You could have been a day trader in Wall Street making $1 million a day, taking a job with less stress and more predictable hours. I've said this 1,000 times. You could have pursued something that looks shiny from the outside. Instead, we're going to work long hours. We'll be up at 3 o'clock in the morning. We'll be leaving our families on holidays to go to work. We often have to work with folks who are having their worst day of their life. Sometimes we have to joke to ourselves about the choices that we made, and we have to say, what is wrong with us for choosing that life? But the better question is, what's right with us that we should choose the harder path? The question is simple, and the choice, of course, is noble. It's the carrying path. We did it with purpose. And here's why, folks, because we care. Because you believe you can make a difference in someone's life, and you will. When someone is sick and alone, you will be there. When someone is hurt and needs to heal, you will be there. When a family is staring down an impossible decision and can't think past the next moment, you will be there. We need you. Our community needs you. And today, you have all answered the call. Thank you. I've had the privilege of serving our healthcare community for 40 years. I love being a nurse. That's my role in healthcare. Regardless of my specific role, I love the work, I love the relentless challenges and its unexpected graces. My wish for each of you is that you love what you do too. That you'll find meaning in moments both small and grand, and that you'll make a difference in someone's life every single day. There's a few moments that you're going to recognize a lot sooner than you think. First, the clinic moment. A parent brings in a scared 5-year-old child with a broken tooth playing baseball. You're the dental assistant who greets them, gathers a history, and explains what will happen next. You speak calmly at eye level. You earn trust in under 2 minutes. Sometimes the most therapeutic intervention is not a medicine or procedure. It's the person who de-scares healthcare. Second, the OR moment. You're scrubbed in. The room is a choreograph of intention. Surgeons, anesthesia, technologists, nursing, all moving in a precise rhythm. You anticipate the next instrument before it's even requested. You protect sterility like a hawk because you know infection prevention is not abstract. It's the difference between a discharge home and a complication that steals someone's tomorrow. The case ends well. Your role, essential. That's healthcare. Third, the night shift moment. It's 3:17 a.m. The alarms are quiet for now, and the unit is dim except for a pool of light over the charting station. You go in to check on a patient who hasn't slept. You sit down, you listen, you adjust a pillow, you bring a warm blanket. There's no audience, there's no applause like today. But something changes in that room. Your patient heart rate slows, the breathing eases, and a person who felt invisible suddenly feels seen. That's healthcare. My question is, what will you carry from today to your first day and beyond? Number one, curiosity. In healthcare, certainty is comforting, but curiosity is safer. Ask the extra question. Validate the vital sign that doesn't make sense. Recheck your instruments even when you're confident. Ask your patient again, what happened? The best clinicians I know are relentlessly curious and humble enough to learn from everyone. Teamwork. I promise you this. It's hard to do what we do when you're the only one on the team. Be the colleague others are relieved to see come on shift. The one who jumps in without being asked, who hands off thoroughly, who gives credit generously, and who treats every single team member, every single role with respect. Titles matter less than the mission we all share. Communication. Your voice, our voices, are a patient safety tool. Speak up when someone feels off. When something feels off. Close the loop on orders, confirm readbacks in the OR, on the floor, in the clinic. Precision in language turns good care into great care. Let's think about us for a moment. Boundaries and self-care. You cannot pour from an empty cup. Rest is not a luxury. It's part of our work. Hydrate, eat, move, get outside, laugh with people who you know outside of the scrub world. The world is better served by a sustainable you than by a burnt-out hero. Lastly, joy. Healthcare will break your heart sometimes. Let it also heal you. Celebrate small wins, the first unassisted post-op walk, the quiet thank you from a patient who never smiles, the moment a patient improves because of the care you delivered. Joy should not be a luxury. It needs to be our fuel. To the people who got you here, everyone seated behind you, thank you for the rides to school, the child care, the extra dinners, the lunches, the pep talks, the patience during exam week, and the beliefs and the belief you loaned our graduates when their own supply ran low. You are also a part of today's achievement. Clinical preceptors, industry partners, everyone, you opened our units, ORs, clinics, you opened your playbooks. You taught these graduates, our graduates, the unglamorous, indispensable work of safe care. How to think in real time, how to prioritize, how to adapt. Thank you. Again, to our TCAT faculty and staff, you saw potential and you nurtured it. You modeled professionalism and compassion. You met students where they were and walked with them to where they needed to be. Today is your victory as well. I have a challenge for this class. From this day forward, wear your badge and your scrubs and your dignity with pride. Be fiercely competent in what you do and be fiercely kind. See the whole person in the bed, on the table, in the chair. Treat every patient as though they were your own family, because to someone they are. Remember, in our community, you are often the difference between confusion and clarity, fear and calm, health and sickness. Keep choosing the harder path, the path that demands more of you and gives more back to the world. And when you hear that little voice asking, what's wrong with me? What's wrong with us for choosing this path? Smile and say, everything that's right. On behalf of our neighbors, we have 2.5 million neighbors that call East Tennessee home. Thank you for choosing to care. Congratulations, class of 2026. Go where you're needed. Go where it's hard. Make all of us proud, one patient, one procedure, and one act of compassion at a time. Thank you.
Now we would like the class representative to come up and give her speech. It is Ms. Shamara Smith.
Good morning, everyone. Today is a moment we will forever cherish. Standing here at our penning ceremony is truly an honor. This pen represents more than completion of a program. It represents growth and commitment to serve. During a time when nurses are needed more than ever. Healthcare is consistently changing. Our patients are sicker, resources are stretched, and the demand for skilled, compassionate nurses continue to grow. In the midst of all this, yes, I am. In the midst of all, LPNs remain essential. We are often the ones at the bedside, listening, advocating, and educating, providing hands-on care with patients and families needed the most. We still knowing the responsibility and trust that comes with it. As a class representative, I have the privilege of witnessing the strength and determination of my classmates. Each of us entered this program with a different background, challenges, and responsibilities, yet we support one another to reach the milestones together. This journey was not easy, but through the long nights, moments of doubt, and times when we question ourselves, through it all, we learned that nursing requires a commitment to lifelong learning, staying adaptable, continuing to grow, and always striving to provide safe, quality care. We would like to thank our instructors, Mrs. Christian, Mrs. Christian Arnold, and Mrs. Michelle Anderson. We love y'all. We love y'all. We also would like to thank our families and friends for their patience, encouragement, and support throughout this journey. As we receive our pens today, we promise to serve with compassion, integrity, and professionalism to continue learning and to uphold the values of nursing professions. This pen is not the end of our journey, it's just the beginning. Thank you. Mr. Newsom, thank you so much for taking care of our class in the Hearst Review.
We'll now be presenting the nursing pins. Will the candidates for the pins please stand? Natalie Baker. Sierra Byrne. Kathleen Chang. Gabriella Elliott. Danielle Harris. Kaylee Hines. Paula Malgiri. Kayla McDowell. Angela Myers. Alyssa Lucci. Amy Rawls. Shamara Smith. Aaron Sutherland. James D. Traylor. Casey Vasquez. Valencia Ward. And Elena Weatherspoon. Will the students please stand for the Nightingale Pledge led by Mrs. Stacy Young?
Would you guys please place your hand over your heart, and we will recite the Florence Nightingale Pledge. In the presence of God and those assembled here, I solemnly pledge myself to practice my profession faithfully. I will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standard of my profession, and will hold in confidence all personal matters committed to my keeping, and all family affairs coming to my knowledge in the practice of my calling. With loyalty, I will endeavor to aid the physicians in their work. And devote myself to the welfare of those committed to my care. Welcome to nursing. You guys can be seated. Now I would like to introduce President Kelly Cheney to address the students today.
Good afternoon, everybody. Welcome to TCAT Knoxville pinning ceremonies. It is an absolute pleasure to have you with us today. And I get to do closing remarks, but after listening to students and our guest speakers and others up here, there's really not much I can say that would ever top that. And I'm really not tall enough to see over this podium, so nurses, I'm gonna step out so I can talk to you just a little bit. But for those of you in the audience, we are so thankful for the support that you have shown our students this year. If you are a parent of a student getting pinned today, would you please stand? Let us hear you, see you. All right. Thank you, thank you. Please be seated. How about spouses? Significant others in the room of our students? Yeah, I can see you. I know who you are. And perhaps children of our students being pinned today. Yes, thank you, thank you. We are excited to have all of you in the audience today. But I can tell you on behalf of TCAT Knoxville and the entire administration, we are thankful for your families who have supported you. We are thankful for your loved ones who have been with you every single day. These students, just so you know, they have not only endured countless study hours, relentless clinical time, lots of moving. They've tolerated us moving into a brand new building, some of them on this left side of the room. And our practical nurses out at Blount Memorial Hospital, you have an amazing facility and an amazing opportunity to do things that most nurses don't get to do, and that is to go to class inside a medical facility every single day. That gives you a unique opportunity, and we're very thankful for our industry partners that support that as well. But going back to families and children and spouses, students, I think we owe them. I think we owe them to stand up, turn around to your loved ones, and say thank you on the count of 3. Stand up, turn around. Let's go. Family, I want to hear you out there. 1, 2, 3. So dental assistants, there's not much I can say other than you do things that ordinary people like me could never do. People like me who are afraid to go to the dentist, you are the crutch of everything that goes right in a dental office. So thank you. Thank you for doing what you do, whether it's being that tried and true dental assistants or greeting the patient like me who's already scared and nervous before I even get there and making me feel at ease. So thank you. And thank you for choosing such a noble profession. There are people like me that cannot do without you. And to our surgical technologist, wow. You know, you may be the one who is in the OR doing lots of different things. And we know the surgeons get lots of the credit. Is that fair, Miss Abby? The surgeons get lots of credit for the patient outcome. But the real work behind the scenes happens with the surgical technologist. For that, I thank you. I thank you for being that professional that makes that surgeon work, for making sure that expertise is delivered upon. It is because of you that those things happen in an OR. So I thank you. Our family and friends thank you for that level of professionalism. Now to our nurses, who I can barely see over the top of this gigantic podium here. So if I step out, our IT guys in the back are gonna get a little fanatic on me, but I'm gonna just step right over here so I can see you guys. So, practical nurses, do you have any idea what level of professionalism, grace, relentless care, love, generosity for the profession that you have chosen to go into? You chose this profession. You chose that because you are caring individuals, because you love humanity, because you love the work. And Mr. Newsom was right. It takes a lot to do what you do every day. And there are going to be times in your path, whether you are in dental assisting, surgery technology, practical nursing, whatever that is, you are going to need to take care of yourself in the process while taking care of other human beings who need you desperately. Let me say this to our practical nurses. The care and support that you give a patient goes beyond that. It goes beyond the patient to the family member, to the loved one who is waiting in an emergency room or waiting in a waiting room with a critically injured child, or getting ready to go to surgery for a toddler that may have been in an accident. So the surgery technologist, how do you work well with the practical nurses? It is because you care deeply to make good things happen. And then our dental assistants, just so you know, it takes so much to do what you do every single day. You may not see a patient in crisis every single day, but you likely see a patient in pain every single day. And how you handle that patient will make a difference for them for the rest of their lives. And it will set the outcome for years to come for a family member not being afraid of going to the dentist. So imagine the role that you have in healthcare. You're starting your careers today, but the next 20, 30 years of your career is going to change countless lives. It's going to save countless lives, all because of you being here today. I'm so proud to call you the first class of 2026 at TCAT Knoxville. I'm forever grateful to the family and friends and loved ones in the audience who are here celebrating our students today. It's important work that they're doing, and we appreciate you. We have some uniqueness in this class of graduates today. I won't dive into that too much, but I will tell you, the expertise is over the top, and I applaud you. The administration at TCAT Knoxville applaud you. And to our faculty and staff, whether they're sitting right here behind me or they're back at the main campus doing the things that they need to do so that we can all be here today. I want to thank our entire team, but most of all, I want to thank our students, our soon-to-be graduates, for trusting us with your future. Congratulations to the class of 2026. Let's go.